The state of healthcare in this country is dysfunctional, it's fractured, it is focused on the wrong things that are driven by providers, that are driven by health systems, that are driven by payers, and they're not focusing on patient-driven outcomes.
I would say it's one of the most complex systems.
We're dealing with aging populations. We're dealing with individuals with more conditions that need to be managed, and then it's being coupled with the fact that we have become much more innovative in our ways to deliver healthcare, and then there's the political climate that we're having to deal with.
It's also one of the most expensive and costly systems that we have.
The insurance market in the United States theoretically should be, one, negotiate better prices for care, right? Whether that's for prescription drugs, for hospitals, for doctors, right? They're grouping together a group of individuals or employers, and the goal should be that they are actually able to negotiate lower prices. Two, they should be helping people access healthcare in a way that's meaningful and helpful for them. And three, they should be paying claims, right? They should be paying claims accurately. We don't see that happening.
It's operating exactly as it was designed to do. And that is to reward the wrong behaviors, to withhold care in many instances from payers. And so we have found that the payers in this marketplace have, I believe, so fractured the system that it has destroyed the employee experience with regards to health care.
For your average kind of employer benefits leader, right, the people that I'm working with who are actually in charge of designing and executing a benefits package for employees, they tend to have sort of two things on their mind. One is the CFO of the company or the county that they're working for is constantly saying, what can we do to get our prices down? And then the chief of human resources is saying, but we need to keep our people happy, right? We need to make sure that we're offering competitive, high quality benefits, et cetera. And those two things are very much in tension. And so every employer is having to kind of make a judgment call as to what they're going to do in terms of providing better benefits to keep people happy, recruit and retain, and the recognition that healthcare prices are out of control.
You try and figure out, where do you start as an employer, or where do you focus your attention?
I can tell you there's a common misperception in the marketplace with employees that choice, expanded choice, is equal to quality. Choice is not equal to quality. Quality outcomes are quality. That high cost is equal to high value. Nothing could be further from the truth. And in fact, higher quality care is most often the lowest cost care because you don't have all of the side issues of, infections, falls in a hospital, readmissions, those kinds of things. So many times the highest quality care actually ends up being the lowest cost care.
So insurers are, like anybody else, nearly anybody else in the health system, they're for profit, right? Their goal is to make as much money as they can within sort of the bounds of what the market and what the laws look like. Employers, our goal is to spend as little as we can while continuing to provide access and high quality healthcare. Theoretically, insurers should be working on our behalf. We're paying them quite a bit of money to work on our behalf, but in the end, the more money we spend, the more money they tend to make. And that's just a fundamental problem that is not really well understood. The irony is, I think, that employers and purchasers are basically the system's cash machine, right? Like we are, and I frankly think that insurers, PBMs, pharmaceutical companies, hospitals, they see employers as a cash machine, and they know that they can just continue to drive as many dollars through that as they can. There is a breaking point. I don't know what it is, right? I don't know how high prices have to get or how bad quality has to get before employers just give up and say, I'm not going to do this anymore.
What we're finding is that as we see healthcare providers or insurance companies consolidating, they're becoming those Goliaths. And so what we are doing as employers is we're losing the battle because we don't have the size and maybe the scale in order to go out and have a voice in our ability to continue to hold them accountable for things like patient care, quality of care.
The most common talking point that we see is, oh, it's just all so complicated you wouldn't possibly understand, right? It's very patronizing, I think, for a lot of employers. They will say, well, we may be overpriced on this, but we're underpriced on that, and that's all very confusing, so why don't we just give you an average? Or sometimes they'll say, well, we can't give you prices ahead of time, but we can give you an estimate on what the prices might be. And to all of those, we just call BS. Right? If you give us the data, we'll be able to make sense of it, and we'll be able to make better decisions, and I think that's what they ultimately fear. At this point, depending on who you ask, it could be 50% of all spending that employers have are going to hospital systems. So the National Alliance and all of our regional coalitions, and Dallas-Fort Worth has been a very active part of this, have been part of an initiative to try to demand hospitals release their prices, make them available to employers and purchasers, take advantage of some of the places where we have some transparent pricing, and then ultimately be able to make better decisions. We're also pushing legislation at both the federal and the state level to require hospitals to disclose negotiated prices for all goods and services so we can start making better decisions. We've also been trying to push better policy based on a transparent model that will ban practices by hospitals and health systems that are designed just to increase their prices.
And so at a 30,000-foot level, I think that's where we come in as consumers, as employers, as supporters, where we come in as politicians. It's really trying to figure out how we all work together to achieve a common goal and therefore ensure that we all have the health care that we need, our families need, and then affordability, along with transparency and also being able to solve some of the simplest solutions, which is how we care for people and how we care for our families.
The healthcare system we tend to think of as a national thing, right? Large pharmaceutical companies, large insurers, et cetera. But healthcare delivery is local, right? So if you're a Fortune 500 company and you've got people all over the country, you're still dealing with sort of local market dynamics. What the world looks like in DFW is very different than what the world looks like in St. Louis or Washington, D.C., where I'm from, or Seattle. Each market is different, each set of actors is different. A national organization, like some of the other national organizations that I work with, they're able to kind of target changes at a federal level. But really, the market change needs to happen locally. It needs to happen with really engaged, smart employers, writing the right contracts, making the right decisions, finding the right partners in DFW or in El Paso. That's something that nobody else does, right? A regional coalition has that capacity to really understand the market and help drive change within a market.
But I think the regional coalitions really help. They help empower, they help to educate, they also, I think, give some moral support to other employers and give them encouragement. Try that. Here's something, and also I think feedback around, hey, we tried that, didn't work, but here's some things we did alternatively that do work.
The employers who join our coalition have access to these wonderful resources. They also have tremendous access to the information from the National Alliance. They are a resource that provides not just projects that we can do, they also provide educational resources, they provide sharing information. Really, it's a treasure trove of information and resources and tools.
The mission of the National Alliance, and I'm paraphrasing here, is to provide employers and purchasers with the information, the transparency, and the guts to make a difference. By itself, DFW, BGH, or any of our other regional coalitions can do quite a bit, but they get enormous value out of being part of a much larger community of 40-plus regional coalitions around the country under the National Alliance umbrella. And when you put us all together, we're really quite large. So the National Alliance we just recently finished a survey that we're releasing. We have about 90 million covered lives in the employers and purchasers within our network, which means it's a majority of the employer-sponsored health insurance in the country. We have the ability to really make change regionally, locally, and nationally when we all band together.
So our voice is also strong, not just among the healthcare providers. For example, the hospital systems are having to listen to us because we have a larger voice, and we also have access to tools that shows us just how much they're charging employers compared to Medicare.
If you want to talk about return on investment, is the small membership fees and dues that go along with being a part of this particular group. It is leaps and bounds. You're definitely 10 to 1. at least, because what happens is they open up their network of individuals, which you can't find and put a price tag on, being able to collaborate not only with other employers, but with vendors who serve the DFW area responsibly. So they're going to connect us with vendors and brokers and consultants that are coming into this space and really interested in not just your business, but also making a difference.